The rotator cuff is the tendon that helps us lift our arm. Occasionally, the rotator cuff can be damaged. The rotator cuff is either damaged with an acute injury or a trauma, or with chronic attritional degenerative changes. If a rotator cuff is injured or torn, we usually use imaging modalities such as an MRI to document if the tendon is torn. Depending on the severity of the tear, as well as the age and the activity level of the individual, that person may or may not need surgery. Sometimes we can rehabilitate patients with physical therapy and occasionally cortisone injections. If individuals don't improve with conservative care or they have a large tear, oftentimes we will recommend surgical intervention for a torn rotator cuff. Before the surgery, our job is to give patients the adequate and appropriate amount of information to understand exactly what's going to happen that day. So the pre-admission testing team is an excellent support staff that we are fortunate to have at Northwestern.
Once we've received notification from the surgeon's office, we contact the patient to set up any testing that needs to be done. This would include things like chest x-rays, lab work, and EKGs.
The patient is called the night before to be notified what time their surgery is and what time they need to arrive at the hospital.
Patients having shoulder surgery will need to wear something loose, preferably button up, that is easy to put on after surgery.
On the day of the surgery, the patient checks in at the front counter and meets the staff there.
The patient will be seen by the surgeon who will be performing the surgery.
We'll discuss the procedure, as well as confirm that the informed consent form that the patient will sign matches with the correct extremity. After this, the anesthesiologist will discuss choices and options for anesthesia.
Typically for shoulder surgery, there are two types of anesthetics a patient will receive. The first component is a general anesthetic, and the second component of the anesthetic is a nerve block. Typically for shoulder surgery, there's a specific block that is used to help take away pain from the shoulder after surgery.
Nerve block serves two purposes. First, it can control pain before and after the operation. It usually allows patients to go home feeling limited to no pain because the anesthetic works for approximately 12 to 18 hours. The less pain the patient is experiencing during the operation requires less general anesthesia. So when patients wake up from the operation, they oftentimes go home not feeling nauseated.
Nerve blocks are safe, which is why it's a routine component of our anesthetics for patient undergoing shoulder surgery.
In the operating room, usually there are 3 or 4 people. First, there's the anesthesiologist. Second, there's myself and oftentimes my physician assistant. There will be a scrub nurse whose job is to pass instruments to myself and my physician assistant during the operation. Thankfully, with modern technology, we can do arthroscopic repairs of rotator cuff tears. And no longer do we need to use open incisions to repair a rotator cuff. Arthroscopic surgery is essentially an arthroscopic, minimally invasive modality using small incisions and a camera that allows us to take the torn tendon and reattach it to the bone. Patients wake up in the operating room. A lot of times because of the anesthetic, they won't remember that. But a patient is transported from the surgical suite to the recovery room, at which time a surgical post-operative nurse will take care of them.
After rotator cuff surgery, patients can remove their dressing after 2 days. They can apply Band-Aids and shower.
After rotator cuff surgery, an individual is in a sling for approximately 4 weeks. The sling is to be utilized when individuals sleep and when they're up and walking around. When individuals are sitting down, they can bend their elbow, they can take their sling off.
Patients can return to driving once they are off pain medications and they feel safe to drive. They just need to remove their sling. Patients will be restricted to one arm after surgery for a while, so may need help with chores and food preparation immediately after surgery.
It's important to get things set up at home. It's important to have family members help if possible. Thinking about these things before the operation will typically make the surgical experience a lot better. After about 6 weeks, we start using our arm above our chest level to about the forehead or eye level. After about 8 weeks, we start utilizing our arm above our head or above our shoulders, and that's supervised under the guidance of physical therapy. Physical therapy and occupational therapy is extremely valuable post-operatively to allow and offer an opportunity for the joint to return to its pre-injured state.
For a rotator cuff, it can take anywhere between 4 to 6 months of really rehabbing to get that shoulder back to working well again. The role of the patient is really important as far as rehab goes. They really have to buy into the whole process and understand that we're really trying to work towards getting them back to where they were prior to surgery. Home exercises for the patient is one of the more important aspects of recovery. My advice for the home exercise is to try to really get into a routine.
We aim to advance individuals along a guided physical therapy program over the course of the first 3 to 4 months to achieve their full functional recovery. Most individuals reach their maximum medical improvement somewhere between 4 to 6 months after the procedure. We take measures through anesthesia, through preoperative physical therapy, through postoperative physical therapy, as well as surgical technique to perform the procedure in the least invasive measure, When you come to Northwestern, you're receiving the most innovative, cutting-edge procedure that is available.